Ouch! On my recent film.
Well, this is your... Oh, I think maybe you just using your tablet with keyboard too much. Is it hurt?
No, help.
Oh, I think we have to refer to the clinic to check with Dr. Moore. Please go.
May I help you? My friend is numb at the hand during the assignment. Okay, can I get your IC? Do you have any symptom or anything? Okay. You just can sit there and then I will call your name later, okay? Thank you. Doctor, this is the next patient detail. Problem with the patient? The patient have a numb hand. Alright. Okay, that's an appointment for her. Okay. Nurul Husna, you can follow me.
So, Miss Husna, what brought you up here?
I feel numbness, and sometimes pain in my hand.
I see. Okay, so based on your symptoms, I suspect the carpal tunnel syndrome, which is this can occur when the median nerve is compressed at the wrist, as you can see over here. This is where your wrist feel the compress.
What causes that?
It is usually due to the repetitive hand movement or inflammation that increases the pressure inside the carpal tunnel. So as for this one, I will refer you to the X-ray department for further more vision for us to see if you need any surgery or not. I will call one of my assistants to follow you up with the X-ray department. Jasmine, first can I check your hand?
Yeah, sure.
Here. Hi Miss, I'm just going to wrap your wrist for support before the procedure. All done. Your hand is safely secure. Let me take you to the recovery area. Alright, I'm going to take you to the X-ray room now. The result will be ready as soon as possible, and we will contact you once they are available. Let me help you.
This patient cover investigation dan to confirm the diagnosis before surgery for carpal tunnel syndrome. Talent test involves raising the back of both hands together for 30 to 60 seconds. Numbness or tingling suggests median nerve compression. Final sign is when the doctor tap the median nerve. Tingling or an electric sensation indicate nerve irritation. The X-ray or MRI is done to rule out other causes like irritabilities or fractures.
Next, I will explain the operating room setup. First, the environment must be sterile to prevent infection. We also need sterile supplies, meaning all instruments and material must be clean and properly prepared. Then, local anesthesia is used to reduce the pain during the procedure. Besides that, adequate lighting is important, so the surgeon can see the surgical area clearly. Lastly, important equipment such as suction and cutlery are prepared to control bleeding and start the operation. Okay, now I will explain the preparation of surgical instruments. First, we prepare a hook knife or endoscopic blade, which is used to make a vicious cut. Next, curved hemostat are used to clamp blood vessels and control bleeding. We also use a small retractor to hold tissue open for better visibility. Then, suction devices such as Janker or Clavier are used to remove blood or fluid during surgery. Lastly, scissors or forceps are used for cutting and handling the tissues. Next, I will explain on carpal tunnel relief trapping technique. This section will be focusing on the purpose of trapping, patient positioning, skin preparation, and the correct trapping sequence to ensure a safe and sterile surgical environment. The purpose of trapping in carpal tunnel relief surgery is to maintain a sterile place throughout the procedure. It also allows full exposure of the core muscle, which is essential for accurate surgical process. In addition, trapping helps to isolate the hand, wrist, and distal forearm. This isolation is important to reduce contamination and to ensure that the surgeon can perform a safe incision and handle instruments effectively. The first one is patient positioning. First, we look at the patient positioning. The patient is placed in a supine position. The flexor arm is adjusted and positioned on an armboard to provide stability and accessibility. The hand is then systematic, meaning the palm is taken upright. This position allows optimal exposure of the cervical part, particularly the palm and wrist area. Number 2 is skin preparation. An anti-fatigue solution is applied starting from the fingertips and it is optimally through the middle of the forearm. This technique ensures that microorganisms are effectively removed, reducing the risk of cervical infection. Proper skin preparation is essential before any sterile dressing is applied. And lastly, the number 3 is dressing sequence. Finally, the dressing sequence, which is the face, sterile towels are placed around the operative site to square off the area and define the sterile field. Next, a stocking or hand drape may be applied, depending on the surgical preference. And after that, a penetrated drape is placed all over the hand, exposing only the entire surgical area, specifically the palm and the wrist crease. Tourniquet may also be applied to the upper arm or forearm. This can be done before dressing or covered in a sterile manner after placement to maintain sterility while controlling the bleeding. During the intraoperative phase of carpal tunnel relief, the various considerations must be taken into account. This includes using the appropriate surgical technique, managing anesthesia effectively, and using clear visualization to prevent injury to the main nerve. In addition, special surgical technique has been developed to minimize tissue damage and promote faster recovery compared to conventional open procedure. This technique includes the ultrasound-guided endoscopic technique and mini-incision approaches with its own specific intraoperative method. For ultrasound-guided technique, the surgeon uses imaging to identify accident and guide for recent ligament division. Some methods, such as quick ultrasound-guided incision, are incision-free and use the filament to cut the ligament internally. In addition, the circulatory nurse ensure proper patient positioning, monitor testing protocols, and document the procedure while the anesthetist manages anesthesia and continuously monitor the patient vital signs. First, the surgeon responsible goes for performing incision, identifying anatomical landmarks, and properly dividing the transverse carpal ligament while protecting the median nerve. At the same time, the surgical technologist assists by preparing sterile instruments, maintaining the sterile site, and supporting the surgeon throughout the procedure. All these steps are closely related to the anatomy and physiology of the carpal tunnel, where the main goal is relieve pressure on the median nerve by touching the transverse carpal ligament. Once the ligament is divided, the space within the carpal tunnel increases, reducing pressure on the nerve, improving blood flow and allowing nerve function to recover. Furthermore, the aseptic technique must be maintained throughout the procedure to reduce the risk of infection, even throughout the incident is low. After the procedure, proper wound dressing and care are essential, including keeping the area clean and dry, monitoring for signs of infection, and following the recommended dressing protocol to support healing. Toxicity of the surgery. Carpal tunnel syndrome is one of the most common nerve operation disorders. Approximately 3 to 6% adults are infected worldwide. Carpal tunnel relief surgery has a success rate of about 70 to 90% in relieving. It is one of the most commonly performed hand surgeries population. So now post-operative steps. First, use a right spring on bandage to support the right. Elevate the hand to reduce swelling. Support the left lifting or sternum and lifting. Use the right spring on bandage to support the right. Perform gentle finger exercise as advised by the doctor.